The Teach Back method. What is it, what does it do, and why is it important? I'm going to start with the PICOTS. The P stands for patients or those in hospitals that have chronic conditions, and does teaching back increase positive outcomes in patients. The I is teach back to patients and look at studies. The C is teaching back versus not teaching back. O is teaching back increasing positive outcomes in patients. T is over hospital stays or chronic conditions. And S is hospitals, homes, or doctor offices. Have you or someone you ever known been to a hospital? The answer is probably yes. But were they ever given instructions on what to do back home? The process is called the Teach Back method, and it's a very valuable tool in hospitals. The Teach Back method is whenever a patient is taught what to do to provide care for themselves at home, but then is then required to teach back to the nurse or doctor to make sure they understood the information correctly. There is a quasi-experimental research study on the readmission rates of total joint patients. There was a decrease in 30 days readmissions by 36% because of the Teach Back method at discharge. In a recent study of patients with heart failure, using the Teach Back method reduced a 30-day heart failure readmission rate from 18 to 13%. According to Kessel's 2003, much of the information that is taught in healthcare settings is complicated, and it's estimated that up to 80% of the material is not able to be immediately recalled after a teaching session. In addition, up to 50% of the retained information is incorrect. The settings for the Teach Back method is usually going to be hospitals, but it can also be doctor offices or at home whenever the patient has to care for themselves. The population is anyone who's in a hospital for whatever reason there may be. There can also be teaching at a level that the patient can understand, can also be part of the population, because health literacy level and using images or diagrams can help a patient understand what could be occurring and what they need to do, as not everyone has the same health literacy level. The population is also anyone who needs to be taught how to care for themselves when not in the care of medical professionals. The main outcome of the Teach Back method is for patient safety, but also to lower readmission rates for the same issue that one may have gone in for in the first place. The Teach Back method decreases more complications with medical issues. The Teach Back method can also help patients understand what to do, how to do it, when with the reevaluation and re-explain technique. The picture on the right shows the Teach Back teaching method. The steps are evaluate patient's baseline knowledge, because this will help you be able to teach the patient better on what they may know and what they may understand. Next is to teach what they know. So if they have diabetes, teach them on insulin, for example. Don't teach them on all the fancy glucose terms that they may not even know. The next and the final step is to reevaluate and re-explain. Repeating can also help with the retaining of information. As stated before, that up to half of the information retained is incorrect. And then the picture on the left just shows that you teach the doctor teaches you, and so forth.